When I first landed on the HealthSherpa website, the interface looked surprisingly clean and straightforward. It immediately presented me with options to browse health insurance plans under the Affordable Care Act, which is its primary focus. The platform positions itself as an alternative to healthcare.gov, promising a faster and more streamlined experience. On the homepage, I noticed that it highlights ACA-compliant plans, Medicaid options, and even resources for subsidies. This clear categorization makes it easier for new users to navigate without feeling overwhelmed. Starting with the plan browsing tool, HealthSherpa asks for basic information like zip code, household income, and family size. The purpose is to match you with eligible subsidies and available plans in your area. The process was fairly quick, and the results page provided a detailed breakdown of premiums, deductibles, and out-of-pocket costs. Unlike some insurance comparison sites that bombard you with vague or promotional results, HealthSherpa's results felt more transparent and tied directly to official ACA data. However, one drawback is that the interface sometimes felt cluttered once the plan results loaded, especially when multiple filters were applied. I appreciated that the site allows you to calculate subsidies directly, which helps you understand the real monthly premium cost rather than just the unsubsidized number. Another feature worth noting is the option to compare several plans side by side, which is crucial when you're trying to decide between similar coverage options. The filtering options let you narrow results by deductible levels, provider networks, and plan tiers like bronze, silver, and gold. Still, I found that the filtering speed slowed down the site, which could be frustrating if you're in a hurry. In terms of enrollment, HealthSherpa claims that you can apply directly through its platform without being redirected to healthcare.gov. I tested this process, and while it did work, I ran into occasional glitches where pages froze or required me to re-enter information. For a site that markets itself as being faster and more reliable than the government portal, these technical hiccups were disappointing. That said, when the process worked, it was noticeably smoother than healthcare.gov, with fewer confusing steps. Customer support is another area that stood out. HealthSherpa provides access to licensed agents who can assist with the application process. The live chat and phone support were responsive, and I didn't feel pressured into making a particular choice, which is a relief compared to some private insurance brokers. Still, one downside is that the site's knowledge base is limited, so if you prefer self-service resources, you may feel like there aren't enough detailed guides available. The platform's emphasis on affordability is real, but it's important to note that it doesn't offer plans outside of ACA-compliant insurance. If you're looking for short-term coverage or alternative insurance options, this isn't the site for you. HealthSherpa is narrowly focused on ACA enrollment, which can be both a strength and a limitation depending on your needs. Overall, my honest experience with HealthSherpa is that it's a useful tool if your goal is to quickly find ACA-compliant plans and check your subsidy eligibility. It simplifies parts of the process, but it's not without its flaws. Occasional technical issues and a limited scope of available plans mean it won't be the right choice for everyone. Still, for someone looking for a more user-friendly approach than healthcare.gov, it's worth considering. If you found this review helpful, make sure to subscribe to my channel and give this video a like so I can continue bringing you honest reviews of services like this one.